Okay, let me go ahead and get started. Again, my name is Jennifer Glaze of JGlaze Speaks. I'm a clinician. I've been working in the fields of mental health and addiction for the past 10 years. I've been working in the field of HIV awareness for the past three and a half years. So I just wanted to do a quick scope on HIV 101, talk about it briefly. I wanted to talk about how you contract HIV because a lot of people have a lot of misconceptions about the virus, so I want to talk about it. Let's see. So here's a map that represents HIV and what HIV looks like in the United States. So the darker the areas, the more cases of HIV are present. So let me just go ahead and get started with the information, with the content. Let's see. So HIV is primarily it's a sexually transmitted disease. That's primarily how the virus is contracted, through unprotected sex, vaginally, anally, and oral sex. If you have a partner who is HIV negative and a partner who is HIV positive and you all have unprotected sex, then it is likely that the virus can be transmitted. Another common way of transmission and a way that we're seeing a rise in the transmission of HIV is through IV drug use. And that is in turn heavily with the rise of heroin or opioid substance use. So we're seeing a rise in the HIV transmissions through that activity, or through that, we would call it risky behaviors. Let's see, the third way is mother to child transmission. So when a woman is pregnant, if she's HIV positive, whether she knows it or not, she can transmit the virus to her unborn child. That's one reason, or another reason out of the multitude of reasons why prenatal care is so important for pregnant women. Because during that prenatal process, when they're working with their doctor, they'll get tested for all kinds of things, and included in that should be an HIV test. Because if the woman is HIV positive, and she may just find out when she's pregnant with that child, but if she is, there are medications that the mother can take that will prevent the transmission of the virus from the mother to the unborn child. So that's why that care and that knowledge is so important. And then finally, but let me say this about the mother to child transmissions. Pretty much transmission from mother to child is pretty much non-exempt, because there's been such a push to get the prenatal care, and we have wonderful medicines involved now. So mother to child transmission is pretty much close to zero, which is a wonderful advancement in the field. Hey, thank you for joining. I really appreciate it. Thank you for all of you all are joining. And then finally, sometimes us healthcare workers have what we call needle sticks. So you may see when if you go to the doctor and they draw blood and they are careful to put the needles in certain biodegradable, or biohazard, I should say, receptacles. That is to prevent anybody else from getting stuck with that needle again. But occasionally things happen where someone who may be HIV positive was stuck with the needle, and at times somebody could bump into something, or maybe the needle was not disposed of properly. Maybe it was just thrown in a trash can instead of being put in the biohazard material, and then someone could get stuck, and that is a potential way to transmit the virus as well. So just to recap, we've got 4 basic ways that HIV is transmitted. It's going to be primarily through sex, then IV drug use, then mother to child transmissions, pregnant woman, unborn child, and then finally needle sticks for our healthcare workers. So those are our primary ways that HIV is transmitted. If I could back up to sexual transmissions, even those transmissions have kind of a graduated, so to speak, way of transmission. So the most frequent way we see transmission of HIV through sex is through anal sex. Then the next most frequent way is through vaginal sex, and then finally through oral sex. I want to remind everybody that many groups of people participate in anal sex. Anal sex is not just something that is practiced by the homosexual community. Many heterosexual people enjoy anal sex as well. So it's not HIV, and here's the misconception we need to get through. HIV is not about who you are, it's about what you do. It's about what you're practicing in. So we a lot of times categorize it as it's just one group of people who are involved in certain behavior, but when you really break it down and look at it, many people are involved in unprotected sexual activity. Many people are involved in vaginal, anal, and oral sex. So basically, if you're having unprotected sex, HIV is an STD that you need to be aware of. That's what I'm trying to get across. And this map represents the importance of getting to the root of this problem, talking about it, and just identifying what your potential risk might be. And everybody has a risk. Everybody has an HIV status, be it positive or negative. Everybody has one. So let me go to a couple other things. So we kind of talked about, my next point was who was susceptible to HIV, which I wanted to get the point across that everyone who is sexually active, everyone who is involved in IV drug use, they are susceptible to HIV transmissions. We're seeing a rise in our young people being infected with HIV, ages 13 to 24 years of age. So, and which is really disturbing, but we are finding that young people really, before they've gotten a chance to really get involved with life, they're being infected with a virus that's going to impact them for the rest of their lives. Now, living with HIV is not what it was in the 80s. It's not the death sentence that a lot of people saw it as. People are living their lives similar to what their typical lifespan would have been, but it's still going to impact them for the rest of their lives. They're going to need to take medication for the rest of their lives. They're going to need to talk to their sex partners for the rest of their lives. So it is a tremendous change that if they don't need to go through, they shouldn't have to. So we have to open up this conversation back up to our young people and our adults as well, and our elderly population who are a lot more sexually active than they have been in the past. That creation of that little blue pill, as they call it, has contributed to a lot of people, a lot of our older population with increased sexual activity. And again, HIV is an STD. HIV does not discriminate. It does not matter who's on what end, how old they are, what background they come from, educationally or financially. None of that matters. When HIV is present, it's looking for a host body. It's looking for a body to latch onto. And if that's what it's given, that's exactly what it's going to do. Let's see. Is my next point, my final point, is HIV transmitted within committed relationships? 100%, absolutely. It's unfortunate, and it's not something that people talk about, but I do think we need to talk about it. At times in relationships, partners step out of the relationship. They move on. They may step out and have an indiscretion, and at times, sometimes, yes, they acquire a sexually transmitted disease, and yes, sometimes that is HIV, and then they inadvertently bring that home. So I always encourage my people in committed relationships to still have a HIV test on a regular basis. As a matter of fact, I would encourage every person to be tested for all STDs regularly, and don't just, unfortunately, you can't always just go by what your partner's word is. I'm a firm believer that you have to be responsible for yourself. and take care of yourself, and get yourself checked out, because for any and everything, and it's unfortunate, but it's the world that we live in. And yes, I've seen many times men and women in committed relationships who were infected by their partner. It's just a fact. Heterosexual, homosexual, men, women, black, white, doesn't matter. Doesn't matter. Again, like I said, HIV doesn't discriminate. So I'll go ahead and take this opportunity to wrap up. I want to thank everybody for taking the time to listen, and I'll look to kind of bring this information maybe once a week. I'll say Monday or Tuesday nights is what I'm going to be looking at. So thank you for your time. Take care. God bless.